I'm in my early 50s and was wondering how the new health care law would benefit.
I don't know much about it.
I'm on Medicare Part D, and I'm wondering how the new law will help me.
I would like to know how the new health care law is going to affect my children, grandchildren, and great-grandchildren.
Have questions about the healthcare law? You're not alone. AARP South Dakota wants you to better understand the law so that you can make the best possible healthcare choices for yourself and your family. AARP South Dakota brings you healthcare and you.
Thank you for joining us. I'm Kathy McClear, Communications Director for AARP South Dakota. Whether you are 5 days old or 95 years young, healthcare affects us all. In 2010, Congress passed the Affordable Care Act. Maybe you've heard some of the myths and rumors about what this law does and doesn't do. Maybe you're wondering just how this law impacts you and your loved ones. Whether you're in Medicare or still several years away from being eligible for Medicare, AARP South Dakota wants you to have the facts. Over the next half hour, we'll answer some of the common questions about the Affordable Care Act and take a look at the many ways it could benefit you and your family, both now and in the future. We'll introduce you to people right here in South Dakota who are living healthier and saving money as a result of the changes. And we'll direct you to some important resources to help you stay informed so that you can make the best possible healthcare decisions for you and your family. And joining me today is Sarah Jennings, State Director for AARP South Dakota, and Associate State Director for Advocacy, Sam Wilson. Sarah, when the Affordable Care Act was out and Congress was debating, AARP supported this measure. Why did they?
Well, ensuring that all Americans have affordable and accessible health care has been something that AARP has fought for since our beginning. And so when the opportunity came in Congress to work on a bill and eventually a law that could really help people all across this state and all across this country, we jumped at the chance. And we really had priorities going into it that we kept an eye on throughout the entire very contentious debate. And that really was looking out for strengthening Medicare for the 65-plus population, and then also leveling the playing field for those under 65 who have had a lot of struggles to find affordable health care because they maybe didn't have it through their employer or had a pre-existing condition. So there were a lot of provisions within that we really worked hard on and kept our eye on throughout the debate. And in the end, it was contentious, and there are no calm opinions about the health care law. But in the end, it's not perfect, but there was a lot of good stuff in there for our members, for all of the 50-plus crowd and their families all across South Dakota, and that's why we supported it. And I'm glad we're going to talk tonight about a lot of the ways that people are being helped already by the law.
Okay, well, now that the law is in place, Sam, what's AARP's role going forward?
Well, really, it's an important transition from advocating for the law to educating the public about the law. As has been said, there truly is something for everyone in this new law. The problem is oftentimes there's a disconnect between that policy-making process and then understanding how to access those new benefits. So AARP, through a wealth of resources that we've created, both through our website and materials that we're able to distribute to our members and the general public throughout the state, are trying to provide those key education points so that people do know really the timelines that are underway for the implementation of the law and what benefits are available.
Okay. While many aspects of the Affordable Health Care Act won't take effect for a few more years, many South Dakotans are already starting to notice some of the positive changes as a result of the Affordable Care Act. Here's one couple that's already seeing a difference in their pocketbooks and in their health.
After 50 years of marriage, children, and 3 grandchildren, Bob and Karen Stevens still have a lot of living to do.
One of my goals is that I'd like to see my grandsons graduate from high school, and that's going to be more than a few years along the way. So yeah, I think so. I think that keeping healthy, I think, certainly will help us meet some of those goals.
For Bob and Karen, that means regular checkups and important screenings. That's how Karen's doctor caught her cancer over a year ago.
My doctor's the one that discovered it when I went in for my yearly
yearly checkup.
Between Medicare and the Stevens supplemental insurance, her treatment was covered.
Karen had breast cancer without Medicare. I don't know how we'd have paid the bills.
But it was their supplemental insurance that paid for the checkup and the initial screening, which caught the cancer early, something now covered by Medicare under the Affordable Care Act.
I think it's a tremendous benefit because I believe that a lot of people just defer having those routine checkups because of the cost of dealing with it, and having them available is a huge benefit to very, very many people in this country. Without it, I'm sure that many of those things don't get detected because people look at it and say, well, it's going to cost me X number of dollars. I'm feeling okay, so I guess I don't have to do that.
Bob and Karen are hopeful coverage for preventive care through Medicare will help them stay on top of any future health problems to meet their goals for a long and healthy life together.
So, Sarah, what should people in Medicare know about some of those changes for if they're in Medicare?
Right. Well, something really, really important for all Medicare beneficiaries is just simply that there was a provision in the law that said that their benefits could not be diminished because of the law. There's been a lot of kind of hype out there, probably trying to scare Medicare beneficiaries that something bad's going to happen to them because of the law, and that's simply not true. And the other thing is that there was really, we put a big priority on making sure that all Medicare beneficiaries can still see the doctor that they want to see, and that the choice about their care will always be between them and their doctor.
Okay, I'm sure it's good news for those folks. Well, there are a number of aspects of the Affordable Care Act which are helping folks in Medicare, like the Stevens. Let's go to some of the most common questions.
What kind of preventive benefits does the new health care law provide under Medicare?
Sam, let's talk about some of those benefits that folks in Medicare may already be seeing.
Yeah, starting this year, there were some important changes, particularly in the area of preventive services. As we all know, traditionally Medicare has been really good at treating illness, but not necessarily very good at preventing illness in the first place. Many of the new benefits in the Medicare program have to do with preventive screenings, whether it be for diabetes, cancer, perhaps cholesterol, and other very common ailments that folks as they age have to deal with. In the past, folks had to pay for those out of pocket, or at least a copay for those services. And now many of those benefits are free to Medicare beneficiaries. In addition, they also have access to an annual wellness visit, which in the past was not covered by Medicare, but now it's an opportunity to have a conversation with your doctor on an annual basis about any healthcare changes that have occurred over the past year, and also to coordinate the care that you may be receiving from multiple doctors. So there's at least one place, one physician that knows exactly what's going on in your life.
So it really sounds like a focus on staying healthier rather than treating the sick.
That's absolutely the case, and that's the key to sort of lowering the overall cost of healthcare in our country, moving from that acute care, which is always the most expensive type of care, and preventive services, which are given at a much lower cost and prevent those high-cost ailments.
Okay, great. Well, let's take a look at another question.
I'm on Medicare Part D, and I'm wondering how the new law will help me.
Well, we do hear a lot about people in Medicare talking about the donut hole. Well, Sarah, what does the Affordable Care Act do for those folks, and what is that donut hole?
Well, the donut hole is the affectionate name that we have for the coverage gap that's in the Part D prescription drug program. Even though it has sort of a cute name, it's a very, very difficult circumstance that people find them in if they are in that coverage gap. Closing that donut hole was one of AARP's highest priority throughout the debate on the healthcare law, and we're glad that that was one of our big victories. The donut hole will be closed. Unfortunately, it takes longer than we'd hoped, but it will be closed by 2020, and we're making progress each year. In fact, people are starting to save money even this year.
Okay, Sam, talk a little bit about that. How is that working? How are people saving money already?
Well, as Sarah said, the coverage gap in the Part D benefit has been a thorn in folks' sides since Part D was first implemented. And basically the way a Part D benefit is structured is that you have an initial coverage period followed by the coverage gap or the donut hole, and then followed by a catastrophic coverage part of the benefit. Now in the coverage gap, which used to be 100% of the out-of-pocket cost for the individual, now individuals will have a 50% discount on all brand name prescriptions, and they will have a 7% discount on all generic prescriptions. As Sarah accurately said, those discounts are going to increase over the next decade, so that by the time we get to the year 2020, individuals that fall into that middle coverage period, which probably will no longer be accurately called the donut hole, but when they fall into that part of their coverage, they'll have a 75% discount on brand name drugs, and they'll have a 75% discount on generic drugs as well. So they're going to see a tremendous amount of savings in that part of their Part D coverage as compared to today and in the past.
Well, and Sarah, what does that really mean for someone who maybe is living on a fixed income?
Yeah, I mean, every dollar counts. You know, we have folks in South Dakota who are living on maybe $1,100 or $1,200 a month, which, you know, works out to be $12,000 to $13,000 a year. And you start adding in the fact that food's going up and the cost of energy and all of our costs of living are going up, but prescription drug prices are going up all the time as well. And the fact that they might be able to save a little bit of money over here on the prescription drug side is going to mean that they can really afford all the other necessities to have a good life.
Okay. Well, Sam, so bottom line, what really is the impact on someone who's in Medicare and some of the changes that they might be experiencing now?
Well, the bottom line is that it's going to be a lower cost to them for all of their services, from prescription drugs to their preventive services, as we discussed, and their doctor's visits. So it's a lower cost, but it's also better quality care. Obviously, if people can afford their prescription drugs and they're going to see the doctor for their annual wellness visit, they're able to catch things in the initial stage before they become too acute, which both always has health and economic impacts on a Medicare beneficiary. So better health and lower cost is probably the best two outcomes you could ever possibly imagine, and that's what's in store for Medicare beneficiaries.
That does sound like good news. And about how many people does this impact in the state of South Dakota?
You know, South Dakota has just over 135,000 Medicare beneficiaries in the state, and these new benefits are available to each and every one of those beneficiaries, whether they live in Sioux Falls, Rapid City, or points in between. So it's important to know that they need to speak to their doctor if they have questions about these new Medicare benefits, and certainly convey these messages to their friends and their family and their loved ones so that everyone does know that these new benefits are available, because they need to be accessed because of the critical benefits they can provide, as we've talked about today.
And I know AARP has a number of resources available for that, but if someone is looking for someone else to help them, walk them through the Medicare process, or there's some other agencies that can help?
Sure. Throughout the state, we partner a lot with a group called Shine, and that's a group that they will actually do one-on-one counseling for you as a Medicare beneficiary, and they are a wealth of knowledge. They are mostly volunteers all over the state, but they can answer questions not only on Part D, but on all the other parts of Medicare as well. And really, they are experts, and they are fantastic. So I'd encourage folks to tap into that other resource we have here in South Dakota.
So if people have questions, they don't have to go it alone. There's resources for them. And that is great information for people on Medicare. Sam and Sarah, thank you very much for that. And for more information on healthcare, visit aarp.org/getthefacts. The staff at the AARP South Dakota office also can answer your questions and provide educational information and resources. You can visit our website at www.aarp.org/SD. You can email us at sdaarp@aarp.org or call us toll-free 1-866-542-8172. We'll be right back.